Hi there, how are you doing today? I'm Dr. Lyon, and I'll be doing your eye examination. So, what brought you in to see me? Okay, alright, routine exam for your contact lens renewal. Okay. Okay. And what type of lenses are you currently using? Okay, the Air Optics. Night and day. Alright, very good. How often do you throw those away? Okay, once a month. Perfect. Alright, and you sleep with them on? No? Okay, take them out every night. Very good. Okay, that's excellent. That's the best way to keep your eyes safe and healthy. You know that sleeping in your contact lenses is a little bit more risky than taking them out every day and cleaning them. Okay, what type of solution do you use to clean them? The Opti-Free? Okay, very good. Yeah, that's one I definitely recommend. Okay, and what about your contact lens case? Do you throw that away periodically? Every 2 months? Okay, that's excellent. Yeah, I would actually throw it away once a month, but every 2 months is okay. Alright, and how about your vision? Has that been fairly clear recently? Are you having any vision blur? It's been doing well? Okay, wonderful. Alright, and in the past, have you ever experienced any eye infections? Oh, you did? Oh, okay. When was that? 2 years ago? Okay. And, you had to have it treated with antibiotic eye drops? Okay. Alright. And was there any scarring, any vision loss after that episode? No? Okay. That's wonderful. Good. Alright. And are you on any medications right now? Okay. Zyrtec for your allergies? Okay. Alright. And do you take that year round or just seasonally? Year round. Okay. Okay, yeah. Sometimes Zyrtec can cause a drying effect on the eyes, and that can make it a little bit more difficult to wear your contact lenses successfully. So are you having any dryness issues? No? Okay, well that's good. I'm glad to hear that. If you ever do experience something like that, we have artificial teardrops that I can recommend to you. So just let me know, okay? Alright, well let's start off by having you cover your left eye. There you go. And just tell me what letters you're able to read out there in the distance. Okay. Excellent. That's 20, 30. Okay. And now let's cover your right eye and do the same thing. Okay, very good. And that one's a little better. That's 20, 25. Okay. And now both eyes working together. What can you see? Okay. All right, great. That's actually 20, 25 as well. Good. Perfect. Okay. So we're going to first take a look at your contact lenses through this microscope. This is called a slit lamp. So let me go ahead and get you comfortable. All right. There you go. Is that a good level for you? Okay, great. All right. So now I want you to just focus right here on my right ear. Okay. And now focus right over here on my left ear. Okay, now I want you to the ceiling. And I'd like you to blink. And blink again. Very good. Now look straight ahead at my ear again. And now over here at the opposite ear. And go ahead and look up. Blink. And blink again. Okay, very good. I'm just going to touch your upper eyelid now. Go ahead and look down at the floor. Great. And let's do the other eye. Look down at the floor again. Okay, very good. Alright, great. So your contact lenses look like they're fitting you very nicely. And now we're going to go ahead and see if your prescription has changed at all. So let me give you a case that you can remove your contacts. And you already washed your hands? Oh, good. Okay, that's also very important. Okay, and there you go. You can go ahead and remove your lenses right here. Okay. All right. Here's some solution. Okay. Perfect. Okay, and now we're going to do the refraction part of the test. And so what I'm going to do is I'm going to show you a series of different powered lenses. And I'd like you to compare between the options and tell me which lens makes the letters look the clearest. Okay? And as we go through each one, you're looking for bigger, brighter, and sharper letters. And if I show you an option that makes the letters look smaller or darker, I want you to let me know. We don't want that. And in addition, some of the options might actually look exactly the same. Okay, that's very common during the test. Many of the options will look very, very similar. If that happens, don't worry. Just tell me that they're equal. Okay, that's a very valid answer. Okay, so let's go ahead and start right here. So we have lens number 1 or number 2. Which one looks better? Again, there's 1, there's 2. Okay, you like 1 better? All right, perfect. And 1 or 2? 1 or 2. Great. And how about 2 or 3? 2 or 3. Okay, 3 or 4. There's 3 again. There's 4. Good, and 4 or 5. 4 and 5. Great. Okay. Now take a look at this option 1 or 2. And again, there's 1 and there's 2. Excellent. Okay, now we're going to go over to the other eye. Okay, and 1 or 2. And here's 1. Here's 2. Good. And 2 or 3. Again, 2, 3. Okay, great. And 3 or 4. 3, 4. Okay, 4 or 5. Again, 4 and 5. Okay, excellent. Okay, now let's go ahead and look at some smaller letters. There you go. And are you able to read those? Very tiny. Just do the best that you can. Okay, great. That's perfect. You got 20, 20. Excellent. Okay, now let's go over to the other eye and check that one as well. Okay, and can you still read those tiny letters? Okay. Okay, So it seems like your prescription has changed just slightly. Okay, let me go ahead and write everything down here. And we're now in a minus 2.25. And the left eye is a minus 2.75. And that corrects your vision to 20/20, so that's perfect. Okay, great. All right, very good. So what I'm going to do for you is I'm going to go ahead and renew your contact lens prescription. And it'll be good for 1 year from today's date. Please continue to remove them on a nightly basis, and just make sure that you keep track of when you put them in so you can throw them away after 1 month. That will really help keep your eyes very healthy, free of infection. And if you ever do notice any symptoms like redness, pain, discharge, tearing, light sensitivity, blurry vision, any symptoms like that that come on suddenly, remove your contact lenses. If the symptoms don't subside within a few hours, I want you to come in and see me, okay? That could be a sign of an infection, okay? So we would have to start antibiotic treatment ASAP to get that under control, okay? All right, very good. So do you have any questions? No? Okay, well here you go. Here's your prescription, and I hope to see you again next year. Thank you.